Hello everyone. So today we'll discuss some additional nerve injuries from upper limb and lower limb. First we'll discuss about thoracic outlet syndrome. The thoracic outlet syndrome is a group of disorders that occurs when blood vessels or nerves in the space between clavicle and the first rib are compressed. So thoracic outlet syndrome is because of the compression of nerves and vessels in the thoracic outlet, that is the outlet between the clavicle and the first rib. So this thoracic outlet syndrome can cause pain in the upper limb, that is your shoulder and the neck, and there will be numbness, tingling over the upper limb reaching till the fingers. The common causes for the thoracic outlet syndrome include physical trauma from a car accident, repetitive injuries from job or sports related activities, poor posture, which is drooping your shoulder or holding your head in a forward position, which can compress the nerve in the thoracic outlet area. Pressure on your joints due to obesity, which can put an undue amount of stress on your joints, or while carrying a oversized bag or a backpack. This all can compress the nerve on the thoracic outlet. Certain anatomical defects such as extra rib, which is the enlargement of the transverse process of the C7 vertebra, this also can compress the nerve. And during pregnancy, mostly the thoracic outlet syndrome is seen. If the subclavian artery and axillary veins are involved, there will be a vascular symptoms. These are mostly compressed when the arm is elevated. The elevated arm increases the likelihood of subclavian vein compression in the costoclavicular space because the space narrows with arm elevation. So the athletes who perform overhead activities are more prone to this injury. The clinical presentations are nerve symptoms and vascular symptoms. In nerve symptoms, the most common neurologic sign of thoracic outlet syndrome arises from the compression of lower trunk, that is C8T1 nerve root of the brachial plexus. The symptoms include pain and paresthesia of the middle arm and the hand, fatigue of the upper extremity, and weaknesses of the muscle which are innervated by C8 and T1, such as intrinsic hand muscles. The vascular symptoms are coloration of your hands, which will be bluish coloration, arm pain and swelling, possibly due to blood clot in the veins or arteries in the upper area of your body, lack of color in one or more of your fingers or your entire hand, weak or no pulse in the affected arm because of the compression of the vessels. On palpation, the fingers, hands, and arms may be cold. Arm goes for fatigue with activities as the energy expenditure will be increased and there is lack of blood supply to the arm. Therefore, the muscles won't be getting the vascular supply with oxygen. Therefore, the muscles may go for fatigue. The management for thoracic outlet syndrome is to avoid repetitive movements and lifting heavy objects. If the patient is overweight, then the programs can be prescribed for the patient to prevent the symptoms by reducing weight, avoiding or carrying heavy bags or backpacks over the shoulder can reduce the symptoms. Stretching daily and keeping the shoulder muscles strong can prevent thoracic outlet syndrome. If there is pain and paresthesia, then TENS can be used and nerve glidings can be performed to reduce the symptoms. Next palsy is the backpacker's palsy. It is the nerve injury of long thoracic nerve. The long thoracic nerve is a motor nerve that originates from the C5-C7 nerve root. It supplies primarily to the serratus anterior. Therefore, it is responsible for scapular stabilization, upward rotation of the scapula, and protraction of the scapula. The common causes for long thoracic nerve injury are sports injury with direct assault to the nerve. The nerve may be entrapped in the scalenus medius muscle. Carrying heavy backpacks for prolonged period of time can injure the long thoracic nerve. A traction injury may also occur with combined head flexion, rotation, and lateral flexion to the opposite side with extreme shoulder flexion. This mechanism can injure the long thoracic nerve. Management of long thoracic nerve injury is treatment with rest and exercises to maintain range of motion. Taping of the scapula can be used to optimize scapular positioning during activities of daily living and exercises. Long thoracic nerve injury and thoracic outlet syndrome can be prevented in children who carry backpacks to school. So, according to American Physical Therapy Association, they have suggested that the children should be carrying backpacks which should not be exceeding 15% of their body weight. The backpack also should be fitting properly and both the straps should be used. So these all are some of the important preventions for long thoracic nerve injury. Spinal accessory nerve injury is the next nerve injury which we'll be discussing. The spinal accessory nerve is a motor nerve. It is the 11th cranial nerve and it supplies to the sternocleidomastoid and trapezius muscle. This nerve is vulnerable to injury from blunt trauma, for example, blow from a hockey stick, which is a sports injury, radiation, or any kind of surgical procedure that is done in the neck. It also can be injured due to traction injury. Intracranial tumors also can compress this cranial nerve. Injury can result in paralysis and atrophy of trapezius muscle and the sternocleidomastoid muscle. Interdigital neuromas. It is a lower limb nerve problem. So interdigital neuromas are most common between second and third. Interdigital neuromas are most common between second and third and fourth intermetatarsal space. One of the most common example of interdigital neuroma is the Morton's neuroma, also called as Morton's metatarsalgia. It most commonly involves the second or third plantar intermetatarsal nerve, which are branches of the medial and lateral plantar nerve. This neuroma most often occurs in runners and dancers because of the repetitive dorsiflexion of the metatarsophalangeal joints. Morton's neuroma is most common in females. It can also result from wearing high heel shoes or from trauma, callus formation under the metatarsal head, or inflammatory conditions. Pain and paresthesia are felt at the metatarsal heads and may radiate proximally or into the toes. So, how can we manage this Morton's neuroma? Rest and massage or any other therapeutic equipments that can reduce the pain can be used for reducing the symptoms. Modification of footwear and activity modifications are the first line of conservative treatment for intertarsal neuromas. Mobilization of the intermetatarsal joints can relieve compression of the nerves. Plantar fascia stretch, foot intrinsic muscle strengthening, and calf stretching also can help in reducing the symptoms. So, here we conclude with the upper limb and lower limb nerve injuries and its management. So, the questions in exams may be asked about the clinical features of nerve injuries or management of the nerve injuries, but practically and clinically, we need to understand the levels of nerve injury, utilization of this knowledge during examination and assessment of the patient so that the nerve injury can be diagnosed and rehabilitation protocol can be created. Thank you.